I'm back. On this occasion, I want to talk about OCD. Now, OCD is one of the most misunderstood um, illnesses that there are, and it highly frustrates me because people just think it's people who need, people who need freaks, people who have to have things in symmetry, people who have to be cleaning all the time. That's far from the truth. That's just part of the compulsions. You can get people with pure obsession OCD. Now that involves intrusive thoughts, so it's unwanted thoughts popping in your head, which cause severe anxiety, which make you want to lean towards substance abuse to get away from it, because you're there thinking, well, I don't think like this, so why is that random thought just pop through your head? But this is a fact for you. 4 out of 5 people have intrusive thoughts. Only 1 out of 50 reacts with the distress that any OCD sufferer reacts with. I've got my little things I do with numbers and having to touch things a certain time, and that's, I think, part of my OCD. But so is the obsession side. That's the part that's really, for me, the most difficult to sort of combat, so to say. Now again, medication is quite effective with OCD, and also CBT, cognitive behavioural therapy, and I actually implement a lot of my DBT, so dialectical behavioural therapy skills I've been taught into it as well, and the biggest one is distraction. So if I'm having real bad anxiety, because OCD is an anxiety condition, just to remind everyone, which you probably all already knew anyway, is to change the emotion. So watch something funny on TV, watch an action movie, something a bit lightheaded, just something random. I don't know. I love my snooker, so I just put some snooker on YouTube, an old match. So you know what I mean, one of the classics. Exercise too. I used to be an endorphin junkie, and then I lost my way with my self harm. Anyways, I am progressing okay, and hopefully I'll be in a position where I can get back training hard, because that's when I was at my happiest and my peak, high intensity circuit training. So I think fitness is quite a good one. So like I say again, I'm no doctor, I'm no psychiatrist, psychologist. I don't know what your best course of treatment will be. If you suspect you've got OCD, you shouldn't hesitate to get in touch with your local service, and they'll be able to point someone out that will be able to help you, and get you the right support that you need, whether it's individual therapy, counselling, group counselling, but yeah, there's a lot more to OCD than just cleaning and tidiness. And as a sufferer, you probably know all this, and you probably suffer the same frustrations as me regarding it. The ignorance regarding it. The way sometimes people also almost mock the condition. Take the beep out of it, and it's just not right. But they've probably got, just leave them to it. So yeah, just try your best to zone out. And another thing which I think with OCD is you just work on facts, because with OCD, Doesn't matter what your fear is, you will always seek reassurance of it, that you didn't do that thing that your fear is, or you haven't left dirt in a certain place, or you haven't had this thought which will lead to this thought which will do to this thought, and then 100 thoughts later you're laying there in your bed with a pounding heart coming through your chest of anxiety. So try and think of the facts. Okay, this is what's going through my brain, which has got, by the way, 11 million impulses, which subconscious. Remember that 4 in 5 experience OCD and intrusive thoughts, rather, of some sort, but only 1 in 50 react to the way someone like myself would react. And that's because, for whatever reason, our brain doesn't filter it and let it go. Our brain filters it and it gets flagged up as, hold on a minute, that's not something me. That's not. I don't think like that. I've cleaned that. I've never had that thought towards that. Or your thoughts should go blah, and then you're seeking constant reassurance. And although that helps in the short term, in the long term, it's actually quite counterproductive, if I'm honest with you. Because you're never going to get enough reassurance, and if you're gonna, for me personally, if I'm gonna live a normal life in the community, I can't walk past strangers like asking them for reassurance over stuff. If I'm anxious about stuff, it don't work like that. So I think that with OCD, it's extremely important to get someone qualified to give you that diagnosis, because it's one that is very misunderstood and can be quite easily misconstrued. And try and distract yourself. Try and keep telling yourself that you can't help subconscious thoughts. And that's not even reassurance, that's just a fact, you know what I mean? You're just telling yourself a fact, and reach out to a friend and speak to them, and that should hopefully minimise your pain you're going through with it. But yeah, and again, scroll back through all my videos. I think I should have a longer one on OCD, but once this crash course is done, I'll be able to go back and see which ones that I've missed that need another crash course, so that people are then reminded of that particular thing, if that makes sense. So yeah, I'm going to end this video on OCD there. Thanks for watching, and thank you for supporting me. Bye bye.